neck pain, back pain, headaches. What is the best position to sleep in order to get relief and actually start fixing the problem? I'm Dr. Matthew Posa, and my page is dedicated to helping people and families live a better, healthier life through tips and tricks. So don't forget to like, subscribe, and share this information with people that we know would benefit from it. Here's a quick anatomy review. So you have your neck, your head, and there should be this beautiful cervical curve, this curve that's happening in through your neck. Well, what happens through daily stresses, work, life, habits, just sports, accidents? There's a million things that can change your spine. What happens is most people's spines go out of alignment. It starts building pressure, pinching off the nerves at the base or anywhere along the spine, and that can go all the way down the spine. So sitting too long can really affect the shape, scoliosis, other types of conditions that happen in the spine. So the key here is that when you're sleeping at night, the last thing you want to do is to create a worse curve, to be pushing your body into a worse position, or to do anything that wouldn't help support the normal lordosis, or that curve in your spine when you're sleeping. These are the things I want to go through with you. There's a few things that you need to know in order to get a good night's sleep. Number one is going to be position matters. So if you're a stomach sleeper, a side sleeper, or a back sleeper, it doesn't really matter what position you like. What matters is, are you using the right pillow, the right size of pillow, and are you supporting the position that you like to sleep in the most? If you're a back sleeper, the last thing you want to do is have way too many pillows, creating an arch in your neck, throwing your posture forward while you sleep all night long. Definitely lower those pillows. So for some of you, you're used to this. Maybe you've been told to prop things up. There might be some other health concerns that you need to be dealing with in order to get to this, but the way we would be teaching it is to slowly reduce how many pillows you're using. So if you're using 3 or more pillows, then you would start by removing one pillow and start getting used to that over the next week, followed by the next week after that, removing the next pillow, until you get to a point where you're no longer throwing your head forward. Your head is able to come back and arch backwards as you sleep, which opens up the airway and allows you to get proper rest, relaxing all the neck muscles that are creating tension in your neck or furthering tension in your neck. The same goes for the side. See, if I'm laying on my side and your shoulder is supporting and lifting this up, you want to make sure that the pillow is the right size in order to account for the gap. So if you have too many pillows and your head is like this all night and your spine is crooked, so you're getting into this type of thing, you're going to be creating a lot of stress and tension on your spine. So in this position, make sure that the pillow is the right depth. And usually I'd say if you're sleeping on your side, you'd want a little bit of a thicker pillow. If you're sleeping on your back, you would want slightly thinner pillow to allow for your head to come back. A trick that you can always do is, instead of having, I'll use this pillow here, instead of using the pillow this way when you're sleeping, well, you would turn it this way. And that will allow for you to support the middle of your back and allow for your head to come back. That is something that, if you can already get that extension and you're okay with that, that's something you can definitely try that would help. Now, I have a few exercises that you can do to not only help calm down some of the muscles in your neck, but also help pull any of the pressure that's the base of your neck that's compressing the nerves that go around your head and why you're getting a headache. Especially when you wake up in the morning, if you're noticing that headache, then what you want to do is, before you go to bed, you want to do chin tucks. So chin tucks are very simple. All you're doing is tucking in your chin, you're pulling your spine flat, but you're lengthening the muscles in the back. I would repeat that about 10 times and I would do 3 sets of those, but I will be holding that for a couple seconds and then letting go. It's not the most flattering thing if you wanted to show people, but you're giving yourself that double chin. You're not doing this extension type of thing. You're just bringing it back. The other thing that you want to be addressing is how forward your posture is. As always, if you're having any issues with your spine, please see an expert. You want to go to a chiropractor near you that specializes in corrective care or corrective chiropractic care, which is going to address the underlying issues to allow you to see improvements and get much better. The other exercise / stretch that I want to show you is something to relieve tension between your shoulder blades. This is something you're going to have to build up to. And essentially what you want to do is bring your hands behind your head. You want your elbows to point forward, and this is going to allow for your middle of your back to start arching and getting rid of that roundness, that forward head. If you can do this, then you're going to start by pushing your elbows forward and just doing those neck retractions, so that chin tuck type of thing. So you're just pushing back and making sure that you're strengthening the middle of your back. So that's like a stretch, but also you're going to feel that tension that's going to start building up the strength. While doing that, you want to hold that for a couple seconds. So again, you're squeezing those muscles and you're letting go. And I would be repeating that 3 sets of 10. But if you want to take it to the next level, I would use a wall. You can either use your elbows against the wall like this, and what you're going to do is you're going to let your elbows come up the wall, and you can step slowly backwards so you can get an arch in your back. And you're just going to hold this for 20 to 30 seconds. And you can repeat that as much as you'd like, but I would be doing that at least 4 or 5 times in order to undo the stress in the middle of your back. You can also bring out your arms if you find that's easier. Start a little bit far away and start working your way into just going by what you can and can't do, making sure that you're still staying within your limits. I hope you found this video useful. If you have any questions or comments, please leave them down in the comment section down below. Stay up to date on all our newest videos by clicking on the subscribe button. And every week I'm going to be coming out with more tips and tricks to help you and your family live a better, healthier life. We'll talk to you soon.